Dr. Priya Bhatt. I graduated from University of Illinois Veterinary School in 2009. And since then, it's been a journey over the last 16 years to develop my version of integrative veterinary medicine that I put a lot of faith and love into doing. And I practice out of Glenview, Illinois, and I built Bhatt Integrative Veterinary Specialty, where I combine Eastern energetic modalities, holistic modalities with Western medicine.
So every veterinarian starting out makes mistakes, every single one. What's maybe one mistake that you've made that you'd like to warn the younger generation? Hey, be careful, or just don't do this, do this.
Watch your arrogance. As we get smarter and educate ourselves and have more experience, we think we know everything. But one of the most important lessons that I learned probably about 3 years into my career is that pet parents truly do have the PhD in their pets. And so I recognize that over the first couple of years in practice based on how I would respond to people. That's the biggest mistake I made, and the biggest lesson I would encourage any doctor, any discipline, any age, any years of experience, that always be open to listen to others and learn, and do not close yourself off and be egotistical and arrogant, thinking that you know everything, because you never will.
So our third question gets into the ozone stuff. So in what area or areas is ozone therapy most beneficial in your veterinary practice?
So for me, it's everything, essentially. I mean, we're trained to be able to be dermatologists, oncologists, cardiologists, radiologists, otolaryngologists, everything in veterinary, everything in human medicine, every denomination, we're capable of being that if we study and we pay attention and we learn everything that's under the umbrella, which continues to rise. So there's a lot more that's also being discovered or brought back. But I can literally use ozone every day, and I do. So I will bring it down to basic general practice. Vaccination, do a clean out post-vaccination with rectal ozone, right? Ear infections, dermatitis, gastrointestinal imbalances, ozone clean out. Best I can do to detox a patient right away, create a microbiome cleanse out, and also behaviorally. I'm using this a lot for behavior, for also canine cognitive dysfunction. I see a ton of the endorphins kicking in. So those patients that come in, as long as they're capable of being restrained in a way, not difficulty. If they're really fighting it, we let it go. But if we can give them a nice hug and gently introduce rectal ozone, I always ask clients, watch their faces. And they go from and so I'm definitely noticing everyday practice. Now, those patients who don't allow rectal ozone, I still take benefit into acupuncture with ozonated saline. I will also use ozonated fluids to give medicated baths to clean wounds. And so every day, Jonathan, I do a lot of integrative oncology. I would say that's number two. Number one, I have to say that I see a lot of gastritis and allergies going hand in hand, which makes sense because a gut carries 97% of the immunity. So I really, really enjoy pairing up at least some rectal ozone, sometimes some fecal transplantation with these acupuncture cases that come in with dermatitis and GI issues, because I find with acupuncture alone, I can get actually quite a bit of imbalance going. But when I integrate ozone as well, I get a kind of a better boost and stabilization and balancing.
Awesome. That's great. So you mentioned rectal insufflation, you mentioned acupuncture.
Mm-hmm.
What Are or are there other ways besides those two that you administer ozone to patients? And if so, what would the other ways be?
Yeah, so I we do a lot of nebulization, especially for asthma cases, sinusitis cases, as well pneumonia cases. I have a chronic bronchitis pneumonia case that when during infection has to be stabilized with a lot of Western medications. But I have believed, without a CT, I cannot confirm this, but I believe the lungs have developed quite a bit of scar tissue because this patient has gone through 2 bouts of severe lung affiliated disease, and she's pretty young. So I have advocated that we come in about once a month for ozone nebulization, acupuncture, and rectal ozone. If she's a little bit too much and I can't do rectal ozone, I'll do some ozonated fluids because fluids is life. And so when I ozonate them, I'm just giving them a bigger push. I'm also playing around a lot with, sorry, give me a second here, ozonated glycerin. So I have used ozonated glycerin. We do use it as kind of more of an experimental right now. I'm prepping myself to do prolozone therapy, but based on a very nice lecture that you recently shared by a doctor, I'm actually setting this patient up to do ozonated glycerin. Like instead of PRP, this patient has a possible cancer process going on, so I cannot use PRP. So instead, I'm setting the patient up for having the joints tapped, but instead of doing PRP, I'm going to plan on doing ozonated glycerin. So it will be my first patient doing that in the knee. So you have the history from another clinician. I'm going to be developing this history to see how it goes.
Okay, so can you give one success story, something that sticks out in your memory and your practice, if possible, of use with ozone?
Yes. I had this wonderful patient. First of all, I have a lot of success stories, as you can hear, from how I use it. But the one patient that I will say that is something in our heart that we will always remember, and the client is above grateful for what we did, was a true marrying of traditional medicine and true integrative medicine. This dog and client had been to Wisconsin, Madison, Veterinary Specialty Center in Chicagoland, and then ultimately ended up to me. And this is because the due diligence of her care for her pet had taken her to some exceptional doctors, and ultimately one doctor referred her to me and said, I think Dr. Bhatt can do more. And this is because this dog had multiple myeloma of the spine. There was a tumor there too. And the dog was quadriplegic for 2-3 years, but was not suffering because she was doing rehab and acupuncture and all sorts of things. And she did the due diligence. He was a quadriplegic motor, but he had feeling kind of like to do this, right? So the oncologists were like, I'm sorry, like we have nothing left to give. We've done everything that we can. Now it's quality of life. And so did the specialty center. They said the same thing, which is why the rehab doctor, God bless her, she went ahead and said, I know one doctor who can maybe do a little bit more. And so she came to us. I did, because of my advanced acupuncture techniques, I started off with advanced acupuncture techniques, and she saw a difference. And at that time, I also did rectal ozone. So because this was an advanced case, usually I like clients to see one thing at a time, but this was an advanced case. So I had to hit double. So the first appointment, I said, I'm going to do acupuncture and I'm going to do rectal ozone. And what she saw, first she saw as I was needling, she saw the difference while I was needling and saw how he was improving. And then I hit him with ozone, and the rest of the night and over to the next morning, she was like, it was incredible. He had the best night. He had the best turnaround. She's like, what's next? So I said, well, because he responded so well, we're going to go ahead and just do this 2 protocol for the first 4 weeks. And then we're going to hit with autohemotherapy. This dog lived for at least 3 to 4 months longer, until actually his kidneys gave out. So it wasn't even the tumor. And that also, we did talk to the oncologists at University of Madison, Wisconsin, because they were the first primary caretakers of oncology for this dog. And they said that likelihood the renal failure happened because multiple myeloma took over. But in fact, the fact that he was kicking along, because we kept them in touch. And they were like, this is amazing. What is Dr. Bhatt doing? Continue this care that she's doing because we are so impressed. And so renal failure took him. At that point, because he had a cardiac issue and severe renal failure, we still fought with fluids, but ultimately got to a point where he stopped eating and we had to do the best for him. So I would say with Teddy, that is our first true huge success story, because we worked with the team, a huge team. It was true integrative collaboration with oncologists, with internal medicine doctors, her general practitioner, and rehab doctor. It was a true team approach. She had gone through all of them to eventually land to me. And I extended his period of life and his quality of life until ultimately another part of his system took over.